Hey everybody. So from my last video you may have seen I was talking about a new diagnosis, cancer cachexia. The thing is with that, the reason why I'm making this video, because I don't think anybody's ever really talked about it. In fact, I didn't even know about it until I was doing some research and I came across accidentally. And the reason why another reason why I'm bringing it up is with COVID, weight loss situation that's going with the cancer cachexia is, your doctors may think, oh, she's part of, diarrhea or something else, but it's a much more serious condition. It should not be ignored. It should not be, it can be deadly. All right. So cancer cachexia is something that needs to be taken very seriously. I did probably 5 hours of research reading scientific journals, not like WebMD. That's just very generic information. Scientific medical journals about cancer cachexia. All right. And unfortunately, cancer cachexia isn't being researched a lot. I mean, some of these articles are like 10 years old. It's hard to find recent ones because they figure, well, you've got cancer, you're going to die anyway, who cares? That's kind of the feeling I get when I read something like this. But the thing is you don't have, the cachexia doesn't only happen to cancer victims, but cachexia, it can be a deadly disease. Okay, so this is my notes. I took two whole pages of notes, of information, because my memory is not very good, but it never has been. So I can kind of read what I have. So it's the most common manifestation of advanced malignant disease. That means stage 4 cancer, any cancer, leading to death. Very destructive to skeletal muscles, and adipose tissue when the body senses malnutrition. Okay, so I'm going to pause there. So when I was doing my last treatments, which was chemo, which was 5-FU, or it was also called fluorouracil, I believe, and then an oral pill called Cachexia, I was having a lot of problems with diarrhea. So malnutrition was there. There was an excuse for the weight loss. And then I got, from all that malnutrition, not because everything was moving through too fast, I ended up getting really sick with sepsis and in the hospital for a week. But then I gained my weight back, and I thought everything was fine. Well, that's not the case. So anyway, it says, tumors induce metabolic alteration. So the tumors that I have around my left lung are actually causing my body to change its metabolism. So instead of going after, the sugars in your blood, this disease actually kind of causes almost like a diabetic-like effect where we become more insulin resistant. So insulin is what makes your body able to use the sugar that's in your blood. So if you're resistant to that, your body's not getting the energy, so it has to get the energy somewhere else. But then, it goes on to say that it reduces the ability to fight infection or to handle chemo. So you may have, the chemo may be harder to handle because your body is weak. Higher extent of weight loss, shorter survival time. So the more weight you lose, the less time you have. Weight loss and wasting cannot be reversed by nutrition supplements alone. There's a lot to this. Death when there is 25 to 30% of total body weight loss. That's scary. Because let me tell you right now, when I started my cancer journey, I was 170 pounds. And right now, I'm 118. Okay, so technically speaking, if that was the number, that would be, that would should be dead, right? But I would say but in the last 6 months, I'm just doing some quick math here. In January, I weighed 147 or 137? I can't remember. So to do that, I would take, I'll say 147, and then times it by 75%, because that means how much weight I have left. So times 0.75, that means at 110 pounds, I'm at risk of dying. That's 8 pounds from now. Shit. All right. So yeah, but when you do the 30%, basically it says about 100 pounds. I said like that's my cutoff. So I have to do everything I can to keep from losing any more weight because I won't be able to tolerate chemo very well. I'll get sick easier, and then that's it, right? So now here's some more things about cancer cachexia or cachexia in general. The energy expenditure. Resting energy expenditure, also called REE, it uses up 70% of our total available energy. So, I'm sorry, my nose itches. So when at rest, my heart is beating faster. The cancer is eating a lot of calories, so that'll make you feel tired, and it'll put your body in a state of depletion, which then it says, oh, I need more calories, I need more calories. But what also happens with the cachexia is that it makes your fat less usable. It's like your body says, well, I don't want the fat, I want protein. I'm going after your muscles. And so that's where the problem is with cancer cachexia. It doesn't go after the sugars as well because of the insulin resistance. It doesn't go after the fat. I have plenty of fat in my legs, but there's hardly any muscle. And that's, makes me tired because my poor little leg muscles are doing all this work for a bigger body, So, so the protein is being destroyed. Okay. And it's so albumin is a protein, and that goes down. And then the CRP, which is C-reactive protein, it increases. That's the sign of chronic inflammation, which is bad. Inflammation is bad for cancer. Inflammation does have a good side when it's in an appropriate amount. It helps your body heal. But when it's over high, then that causes problems. It can damage things after that. So another part of cancer cachexia is anorexia, or appetite loss, which I have been struggling with. I'm hoping my medication for that will come in. Also, cannabis has been good for that. I've been doing some research with my particular type of cancer. They kind of look for a CBD to THC 2-to-1 ratio. It seems to be helpful, but I don't like psychoactives, and I've tried the oils like the Rick Simpson type of situation, and I reacted badly to it. So that's like a last resort for me. But the brown adipose tissue increases in function. Is the function of the brown adipose tissue in this setting is it thermogenesis, increases temperature, which burns energy, which means you're going to be more tired. All right. Let's see. That's part of the resting energy. Okay, the anorexia, we already know the appetite. It's an independent and irreversible process. So the appetite loss, it's like it's stuck because there's these little hormones that are chemicals are secreted in the brain and the stomach, and all that gets screwed up. So your appetite it's gone. So you have to basically literally force yourself to eat. Otherwise, you'll lose more weight and get sicker. The aberrant metabolic rate is a direct result or response by the tumors and immune system to disrupt pathways that regulate homeostasis. So homeostasis is where things are working at their best. They're happy, they're level, they're steady, and not all kind of crazy and wild. Neuropeptides and cytokines influence anorexia. The cytokines are basically where the inflammation is coming from for this situation. Anemia, all right? So anemia is when your blood is either you have low red blood cells or your hemoglobin or your hematocrit are low. Those are the parts, the chemicals. I'm not a biologist, all right? I'm a physicist. So might get a little bit of this kind of mixed up, but it's what helps your blood carry oxygen, okay? So when that's low, then your body doesn't have enough energy, to oxygenate everything. So a substance that makes red blood cells osmotically fragile. So osmosis, a lot of you probably know, is where, the things that cells need go through the cell wall, or the cell membrane. Depends if you're a plant or an animal, right? So osmosis, is whether how easily things can pass through the membrane. And so this says that the anemia, that these red blood cells become, the transport's too easy. So things that might need gets taken out, and things you might need no need are getting pushed in. So decreased deformability in plasma is secreted by tumor cells. So again, the tumor cells are causing this damage directly by secreting a chemical. Decreased erythrocytes and immune component cell functions, lowers red blood cell glucose influx. So that means the amount of sugar going in is going down. Your cells need sugar to survive. And pyruvate kinase activity, leads to lysis. Lysis means it's popping the cells, which leads to anemia, which means you have fewer red blood cells. Okay. Now, from this particular article in 2011, the treatment options were omega-3 fatty acids, appetite stimulants, drugs against cachetic signaling. So those are like inhibitors and stuff like that. And I looked at the research and it was a little mediators which help against wasting, muscle wasting. Resting energy expenditure is controlled by anti-inflammatory agents like ibuprofen. Oh, I have that. And so I'll get to that in a minute but it's about 1,200 milligrams a day with what they recommend. So that's, I think the pills I have are 200 milligrams, so it's 6 pills a day, 3 in the morning, 3 at night. Easy enough, right? Protein wasting is inhibited by EPA, which is a fatty acid you can find in fish, seafood, a lot of, stuff like that. And there's a tumor necrotic factor A inhibitor. Those are pharmaceuticals. You'd have to get that from a doctor. The couple of them I've looked at are kind of scary. The main cause of death is respiratory failure. So basically, your body's it's too weak. It can't breathe. Fluid builds up and you suffocate, basically. Low oxygen levels and such. And the more recent one from 2015. Okay, so not that much more recent. So the thing that the other article didn't mention was cardiac muscle is also depleted. So heart failure. Okay, so one of the other articles I remember reading before said that respiratory failure and heart failure are the 2 main causes of death with cancer cachexia, or cachexia in general. So your heart gets weaker, and when your heart's not able to pump the blood through the body, the organs become weaker, they become more sickly, less able to function, and basically you go into organ failure. Half of cancer patients will get cachexia, with as much as 80% in the last 1 to 2 weeks of life. So, that happens. People stop eating, they get nutrition, that's kind of, that's understandable. The best strategy is treat the cancer, as this will completely reverse the cachexia. So the only way to stop the cachexia is to get rid of the cancer. So I just started a new IV treatment called Enhertu, which is for HER2 positive cancers. And I just had my first dose like a week and a half ago. And so far, I feel good. I don't feel like it's really kicking my butt like some of the chemos have. So hopefully this cancer will shrink all the crap that's around my left lung and slow down this damn weight loss. Because if it doesn't, my time might be coming sooner than I was hoping for. Okay, so some of the medications they talked about, the first one's kind of scary. So it's thalidomide. So it's an immunomodulatory. It limits body mass loss, decreases the tumor necrotic TNFA, pro-inflammatory cytokine, so it reduces the inflammation. But this was the same drug that they were given to pregnant women, and a lot of these babies came out deformed. So it's kind of toxic. All right. There's another one that you have to give with docetaxel, or it's a chemo, and it's called Intercept. It's that there's actually another name for it, but anyway, it's an immune modulator, limits fatigue, decreases the TNF, effective against pro-inflammatory cytokines. Okay, so that's kind of the same thing, but you have to take that with chemo for it to be effective. So I'm like, I've already got chemo going on. EPA and omega-3 fatty acids. It's a lipid. All right, it's a fatty acids. May improve weight, appetite, and quality of life. So what quality of life is how good you're feeling day to day. Are you able to do your chores? Are you able to go out and have fun? Enjoy life. And then there's a Japanese medicine, Campo medicine. It's called Rikkunshito. I think I might be pronouncing that wrong. So Rikkunshito. It's a Japanese herbal medicine, and it improves median overall survival time and muscle wasting. So this was really, though, studied on more of intestinal cancers, but with all the chemo that we go through as cancer patients, our intestines really do get wrecked. So this could still be good for just about any cancer, but it was these studies that I got for this one was more about GI cancers. Okay, so but I could see how that could still be beneficial for people like me with breast cancer, because my GI is probably kind of screwed up, but it's a healing, but it's still screwed up. ACE inhibitors, what's a heart medication? What it says here, it reduces wasting at the muscle mass, inhibits TNF pro something or other producers. So some heart medicines could actually be beneficial. I'm actually on a beta blocker, which is also on the list of medications that could help. So it preserves weight and lean and fat mass muscle. Well, I don't worry about fat. My fat's not getting burned off. It's the muscle that's being burned off. Cannabis, THC. Well, everybody's heard about how cannabis or marijuana derivatives are good for appetite. They actually have a pharmaceutical, starts with an M, I can't remember what it's called, but I actually got some coming in the mail from my doctor to give it a try, see if it helps. And but the THC is the part that makes you have mental reactions or psychoactive, and I'm very sensitive to that. Like I said, I tried it before, and I got very sick. I got very dizzy, and my blood pressure went way down, and it was very. I couldn't even move my head without thinking about vomiting, so it was bad. But again, ibuprofen. God, the horses are being crazy outside. 1,200 milligrams a day. And megestrol acetate. That's the appetite stimulant that I'm expecting. 480 milligrams a day. Reduces CRP and increases weight. Megestrol? I think that's the appetite stimulant. My brain's kind of pooping on me. Food. So what you eat does matter. I mean, a diet alone isn't going to fix this or stop it or slow it down. But you need to increase your calories by about 400 kilocalories per day, and protein needs to be increased by about 50%. And here it says in this particular article, 1 to 1.5 kilograms 1 to 1.5 grams of protein per 1 kilogram of body weight per day. So if you take your weight in pounds and divide it by 2.2, you'll get about what your kilograms are. Then take that number and multiply by 1.5. That's how many grams of protein you should be eating a day. Exercise. Now you think, well, you're losing muscle, you're losing weight. This is within your limits, right? So it helps increase insulin sensitivity, which means your body can start using sugars a little more effectively again. Protein synthesis, which you need to rebuild muscle and or reduce muscle loss, and may reduce inflammatory response, which is what's also destroying your muscles. So it improves physical performance, which means you can be able to, your endurance will be better, you'll have a little more strength. But you got to exercise within your limits. If you burn off more than what you're putting in, you're going to keep losing weight. So you got to find that balance. So like for me, I'll just say 120 pounds for easy math. I'm about 54 kilograms. So that means I need to eat between 54 and 81 grams of protein a day. That's a lot. I mean, like one egg has got like 8 grams of protein. So that gives you an idea, you know. So my plan for for however long I can get this going is decrease my protein, of course, take ibuprofen twice a day, and the megestrol acetate, eat more fish, or take an EPA, which is an omega-3 fatty acid, and omega-3 fatty acids. Also DHA is another one you can find in fish and nuts and stuff like that. The metapropyl succinate, which is my heart medicine, I'm going to continue taking that. Increase calories, more frequent meals. So the thing with the cachexia is that I'm finding it's almost like a morning sickness. If I can keep food in my stomach more frequently, I don't feel as nauseous. That's what I'm finding out. I'm just now finding that out. So it's like 6 small meals a day should help reduce the nausea and increase your energy levels. And I found when I eat, I feel better, which, I mean, people think that, but it's a significant difference on how I feel. My energy is like, I still get tired, but I can take a small break and get moving again. Exercise, and maybe look into that Japanese medicine. All right. But like, so this will, all this stuff this will do is fuel for my muscles and preservation of the muscles. This should help reduce inflammation and increase appetite, decrease the flow of inflammatory cytokines, preserve muscle mass, prevent muscles used for energy, improve endurance, and may reduce inflammation. All right. So those are the actions I'm going to be taking over, for however long I can. And hopefully the cancer medications will knock out the cancer or at least greatly reduce it so that my weight loss will come to a stop. That's my goal. So I'm going to be, using a lot of positive thinking, trying to take care of myself, make sure I'm getting plenty of sleep. But, I've hours of research. But for this particular situation, there's not a lot of information. So, especially in this day of COVID, we have to kind of force ourselves to research, what's going on with their health. Because these doctors are, a lot of times, my oncologist she just had COVID, so she wouldn't be able to see me for a certain amount of time. And this cachexia works fast. So if you start noticing something about your weight, I would, let your doctor know. But while you're waiting to see your doctor, do as much research on the internet as you can and look for medical journals. Now, there might be a lot of big words that you don't understand, but that's what Google's for. You can Google it and you can kind of learn some of this lingo. I mean, I've been doing this for 6 years, 6.5 years. So I know a lot of the medical lingo. There's a lot I don't know because I'm not a doctor, but there's a lot I've learned through all this research. I mean, I can read my own PET scans, and x-rays are a little harder to read because, it's just, black and white. But the more you can do to help yourself, help your doctor, the longer and healthier you'll live. But if you just expect your doctor to do everything and you don't give them enough information, or maybe trigger a thought, because doctors got a lot going on too. They're like teachers in a way, as far as the workload. I mean, it's not just seeing the patients. They have to do all this, typing and notes and everything, and then they have to take care of all these other administrative things that they have to do. And doctors are really busy. So the more information you can give them, it helps them do their job more efficiently, and it helps you to be healthier and more well. I mean, the cancer cachexia, that was kind of like me saying that. Doctors, it sounds because all the blood tests that were routine were actually supporting the diagnosis of cancer cachexia and the weight loss. So together we were already like, yep, that's what it is. And then, when I got diagnosed with my autoimmune disease, that was me. I had to, my doctors, because I was on all these cancer medications and think, oh, well, the weight loss and weakness, that's just side effects. I'm like, no, there's something else going on. And so I did a lot of research, and, I learned about myositis, which is the destruction of muscle again. Like, my body doesn't like my muscles for some reason, right? So I requested these tests, and the tests came out through the roof. I'm like, yep. So now I have an autoimmune disease, but it's treated, and it was under control for the last couple of years. And now I have this new muscle-destroying disease, cancer cachexia, caused by the cancer, which is emitting these terrible little chemicals that are screwing everything up. So you got to get rid of the cancer. So you got to do your own research as much as you can, or have somebody help you. If you're not really a reader, maybe have a friend do it. Give them a mission. So people like to be helpful, So give them a mission and say, hey, I'm having this and this. And can you do some research for me and give me some ideas to help my doctor help me? Because not everybody is meant to be a researcher. I understand that. Some are mechanics, some are musicians. Not everybody can be everything. So it's important that you advocate for yourself. And if your doctor's not listening to you, if he's making you feel bad because you feel like they're ignoring you or thinking you're stupid, then you need to find a new doctor. Because just like in any profession, not everybody in that profession is going to be there to help you. They might be there for other reasons. Especially if you're at a research place, maybe like UC Davis. I liked UC Davis, don't get me wrong. But there's some doctors in there that may be more interested in research than actually treating patients. That happens in college too. You get teachers that are more interested in doing research than actually teaching the subject. So you have to understand that not all professionals in any one profession will be there for your interest. They have their own interests as well. So if you don't feel that your doctor's the right one for you, it's okay to say, hey, I don't think this is working out for me. I need to get another opinion. All right. And then the doctor will be like, okay, fine, whatever, They probably don't even care. But, I like my care team. Generally speaking, I think we do a good job. They listen to me, so I feel like I'm being listened to, and that's important. And it's paid off. I'm 6.5 years into stage 4. 25%. The survival rate for 5 years of stage 4 is like 25%. So I'm in the 25%. So I would like to get to 10 years, but with cancer cachexia, yeah, it's not a good chance of that. But that's okay. I'm happy that I've had this long. Hopefully, I'll get another year. I'm hoping for one more year at least. But again, advocate for yourself. Make sure you do your research. Learn about your medication side effects. If something else comes up that's not a side effect of your medication, that should throw up a red flag for you and say, what's causing this muscle wasting, or what's causing these wild headaches or whatever, or blurred vision. Because a lot of medications don't cause, the chemos don't always cause it. They cause a lot of blood side effects like, anemia, low white blood cell count, that causes infection, So, but if you're getting these other odds, know your side effects of your medications, and then pay attention to your health, and it'll help you live better with a higher quality of life. Because once you have cancer, it's all about quality of life and how much time you can get, and feel that when your time's done that you've completed what you wanted to complete in life. And I'm still having to take care of some of that business, the last minute stuff. I'm like, shit, like wills and stuff like that. I'm like, I hate paperwork and making phone calls, but you got to do what you got to do. So anyway, cachexia, don't take it lightly. You're starting to lose, if your legs are getting skinny or your arms are getting skinny, you're feeling weaker than usual to your treatment, that's a red flag. Okay? There's a high proportion of people who get cachexia and cancer. And if you wait, it could cause an early demise. Like, my cancer isn't deadly right now. It's not in my lungs. It's around the lung, but it's not my lungs. It's not in my liver. It's not in my heart. It's not in my brain. I could live years with treatment taking care of the cancer and keeping it under control. But the cancer cachexia is going to rob me if I can't get it under control. The cancer cachexia would be the cause, not the cancer. Not directly. It'll be a side effect. Okay? So be aware of that. Because, just because you have cancer doesn't mean you can't die of something else. So I hope this was helpful. But again, I'm not a doctor, but that's my research, what shows me. And if you suspect that maybe you might be losing weight faster, like I was losing almost a pound a day, that's freaking scary. And that was eating. I'm forcing myself to eat. I'm still losing weight. I'm like, what the hell? And that's when I contacted my doctor and did all this research, and she agreed with me. And, if I didn't do that, I could be dead in a month because I would have ignored it. Oh, it's just a poor appetite. I would have gotten skinnier and skinnier and weaker, probably end up in the hospital and dead. So you have to pay attention to your body. If you want to live, if you want as much time as you can get, you have to listen carefully to the changes in your body. Otherwise, you won't get that time. Everybody dies. That's a fact of life. Everything dies. Trees, plants, birds, insects, everything dies eventually. But to get the most out of your time, you got to listen to your body. Know what's right and know what's wrong. And watch your weight. Alex, I have a pulse oximeter. It's really easy to use. You just turn it on, give it a couple seconds, and it's just turning on. It's going to be backwards, of course, but don't worry about that. The top number is my percent of oxygen, and that's my heart rate. So it says 98% over 81 beats per minute. That's actually pretty damn good, considering I pretty much have just one lung because the one's squished. So that's pretty good. When that top number gets below, 92, I get a little concerned. But that happened when I had pneumonia. So that was something was wrong. And when my bottom number gets into the 90s, I get a little concerned because that means my body is using up too much energy. And that's bad because of cachexia. Again, if you're not eating enough, it's going to burn your muscles, and that's bad. We don't want that. Another thing that you should have is blood pressure cuff. All right? So, you just put it on your wrist, press that, and just keep track of it. So when there's changes in your blood pressure, you can say, hey, doc, my blood pressure is going down really bad. I'm feeling lightheaded and stuff. I'll go, oh, we need to check that out. We'll do an EKG or maybe an echocardiogram to see what's going on with the heart muscle. Because remember, some of these drugs for your cancer could be destroying your heart, all right, or even your lungs. So you have to be aware of that. Another thing I have, and they're a little more expensive. This is a mini EKG machine, and it's super easy to use. You just turn it on. It took me a little learning curve to use one of these, if I can get it to show without it being all. But you basically put it between your two hands. Can get it to work here. No, it's all whited out. But anyway, so it shows your little it shows the heart, the EKG, or I think in this case it's an ECG. But it shows you how many beats per minute. And when you first start using one of those, it's going to look weird. You're going to have to do some research to learn what's normal. And then you have to learn what's normal for you. Because I've been using this thing for probably 2 years. And at first it was doing all these weird things that was kind of worrying me a little bit. But as I did more research and saw over time that, I showed my doctor and he says, okay, that's normal. I'm like, okay. So once you know it's normal, then you can tell over time if it starts changing, then you can say, hey, doc, my EKG is changing. Can we take a look into it? And that way we can catch heart problems earlier. Like right now, I'm on heart medications for heart failure because my heart muscles become weakened from the Herceptin, which is part of my cancer treatment. But that's that's normal. I mean, it's not normal, but it's a known side effect. And I feel fine. My blood pressure's been good. My I don't get dizzy. I don't get lightheaded. So it's working properly, and my heart function is stabilized in the mid 40s. So when you get down below 40, then you start having worries about really severe congestive heart failure. So, but right now it's just left ventricle. My ejection fraction, which they call it, is a little bit low, but I'm still able to function. And my oxygen levels are good, and my blood pressure is good. So together, all that tells me we're okay with the cardiovascular